Today we will discuss concussion, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. A concussion is a type of brain injury that happens when your head gets bumped, shaken, or hit hard. It can affect how your brain works, even if you don't lose consciousness. Signs you might have a concussion. 1. Headache. A common symptom, it can feel like a pressure or dull ache. 2. Confusion. You might feel disoriented or have trouble remembering things. 3. Dizziness, feeling lightheaded or unsteady. 4. Nausea. You may feel sick to your stomach. 5. Balance problems, difficulty walking or coordination issues. 6. Sensitivity to light or noise. Bright lights or loud sounds may bother you more than usual. 7. Fatigue, feeling unusually tired or sleepy. 8. Mood changes, feeling irritable, anxious, or sad without a clear reason. What to do? If you suspect you have a concussion, it's important to see a healthcare professional. They can evaluate your symptoms and decide on the best course of action. Rest is crucial for recovery. Avoid physical and mental activities that could worsen your symptoms. If symptoms are severe or worsen, seek emergency care immediately. If someone has a concussion, here's what to do in simple steps. What to do? 1. Stay calm. Keep the person calm and reassure them. 2. Rest. Encourage them to sit or lie down in a quiet place. 3. Avoid screens. No phones, tablets, or TV. It can make symptoms worse. 4. Watch for symptoms. Keep an eye on them for any worsening symptoms. 5. Seek help. If symptoms are severe, like confusion, vomiting, or severe headache, get medical help right away. About sleeping, sleeping is okay. It's a myth that you shouldn't let someone sleep after a concussion. However, you should check on them regularly while they sleep to make sure they are okay. If unconscious, if they can't be woken up or are very sleepy, seek medical help immediately. Rest is very important for recovery. In the hospital, here's what doctors typically do for someone with a concussion. 1. Check symptoms. They ask questions about how the person feels and what happened to understand the injury better. 2. Physical exam. Doctors check balance, coordination, and reflexes to see how the brain is functioning. 3. Imaging tests. If needed, they might do a CT scan or MRI to look for more serious injuries like bleeding in the brain. 4. Observation. The person may be monitored for a while to see if symptoms get worse. 5. Advice on rest. They usually recommend resting both physically and mentally, avoiding screens and not engaging in sports or heavy activities for a while. 6. Follow-up care. The doctor will provide instructions for recovery and when to return for a checkup. The main goal is to ensure the person is safe and to help them recover properly. While there's no specific medication to cure a concussion, doctors may recommend certain treatments to help manage symptoms. Here are some commonly used medications. 1. Pain relievers. Acetaminophen, Tylenol, often used for headaches and pain relief. Ibuprofen, Advil, Motrin, another option for pain, but should be used cautiously as it can increase the risk of bleeding. 2. Anti-nausea medications. Promethazine, Phenergan, helps reduce nausea and vomiting. 3. Sleep aids if necessary. Melatonin, sometimes recommended to help regulate sleep patterns. 4. Cognitive and mood support. Antidepressants. In some cases, if mood changes are severe, doctors might prescribe these. Always consult with a healthcare professional before taking any medication for a concussion, as they can provide the best guidance based on individual needs. Rest and recovery are the most important parts of treatment. Certain groups of people have a higher chance of getting a concussion. Here's who is at increased risk. 1. Kids and teens. Younger people are more likely to get concussions because they play sports and are still developing mentally and physically. 2. Athletes. People involved in contact sports like football, hockey, soccer, and boxing are at greater risk due to the physical nature of these games. 3. People with previous concussions. If someone has had a concussion before, they are more likely to get another one. 4. Active lifestyles. Those who participate in activities like biking, skateboarding, or skiing can be at risk due to potential falls or collisions. 5. Older adults. Seniors are more susceptible because they may have balance issues and are more likely to fall. 6. Certain occupations. People in jobs that involve high risk activities like construction or law enforcement may face a higher risk. Being aware of these risks can help people take precautions to avoid concussions. Now you need to watch my video on strokes or have a look at heart attacks.